Good afternoon, everybody. My name's Clare Stevinson. I'm a researcher at Loughborough University, and it's particularly nice to be in Bristol today for this conference because this is where my research into exercise and cancer first started about 15 years ago. And today I'm back here to share with you some of the evidence about the importance of exercise. So I'm going to briefly introduce some of the key benefits of exercising, mention some of the possible risks and how to minimise those, and just finish with some recommendations. And if anyone has any particular questions, I'm very happy to try and answer them later on today. There are, of course, many benefits of exercise. I'm going to focus just on those which are particularly relevant to people with cancer. And what you'll find is most of the evidence is in general cancer populations or in other cancers. There's very little in melanoma specifically, but most of what we cover has commonalities across cancer groups, so hopefully it will feel relevant to you. We'll start with the benefits of exercise for physical function. I'm going to show you this quite interesting study where the researchers compared three groups. The first were people with cancer diagnosed within the last 5 years, so they call these short-term cancer survivors. A second group who were diagnosed more than 5 years ago, longer-term survivors. And a third group matched on age but had no history of cancer. They were asked to report their physical limitations. And interestingly, in both cancer groups, over half the participants reported experiencing physical limitations, physical function problems, which was substantially more than the healthy control group. And if I show you the most common difficulties that were reported, you can see that they are all things that we need for basic activities of daily living. So housework, gardening, shopping, childcare, hobbies, travel, fundamental aspects of life, and limited in over half cancer survivors, even long-term, long after they've completed treatment. One of the reasons for this would be lack of physical activity following diagnosis and treatment. It's one of the most fundamental things to keep oneself physically functional. A second reason relates to fatigue. The fatigue of cancer and of cancer treatment, and that might be a feeling that some of you can relate to. So cancer-related fatigue, this mental or physical feeling of exhaustion or tiredness, very common, often quite persistent, distressing. Just show you some data on how common it is and how persistent it is. So research has shown that even at the point of diagnosis, 40% of patients are reporting this distressing level of fatigue, disabling, preventing them from doing activities of daily living. During some treatments, it's the vast majority of patients who experience it, but you can see that a substantial proportion of patients, even 5 or 10 years afterwards, are still experiencing this disabling fatigue. And traditionally, the advice to manage fatigue, we know it's particularly difficult to manage. And advice years ago used to be based around energy conservation. So rest is best. And rest is important, but it can be problematic if there's an overemphasis on rest at the expense of any physical activity. We have this vicious cycle developing. So excessive rest leads to people becoming very deconditioned. And patients tend to be deconditioned after treatments anyway. So as they lose any physical function, muscular strength and aerobic fitness, then fatigue is greater with every aspect of living. Just going up and down stairs or fixing a meal becomes even more exhausting. So further rest, and you can see the cycle develops. So the modern thinking is it's important to balance rest with adequate, sensible levels of exercise. in order to prevent this vicious cycle developing or to help people escape from it. And let me just show you a study which demonstrates this quite well. So this was a trial with prostate cancer patients. They were about to undergo 4 weeks of radiation therapy. They were randomly allocated either to an exercise program, this meant walking 3 times a week for the 4 weeks of their treatment period, or the second group were just given traditional advice to rest if they were tired. This was a study that took place up in Dundee in Scotland. Let me show you what happened to their physical function and to their fatigue levels. So here are the results on physical function. This is measured with a walking performance test. You can see at the start, before treatment, they're both about the same level. The walking performance was the same in both groups. By the end of treatment, when they redid the test, the green line there, the walking group, you can see that their physical function has improved. The pink line there, that's the resting group. Theirs has stayed about the same. Actually, it's declined slightly. So an increase in physical function through the walking programme. Let's see what happened to their fatigue levels. Again, at the beginning, before the treatment period started, fatigue was the same in both groups. During the 4 weeks of treatment, it has increased in both groups, the effects of radiation, but you notice that it has not increased as much in the walking group. It is much higher among those who were advised to rest. In the following month, after they finished treatment, there's a decline in fatigue. It's gone back towards normal. But you'll see again that in the walking group, it's actually lower than where they started. The fatigue is much reduced, whereas in the resting group, it is still quite high. And there are lots of studies to back that up, that exercise, if it's a sensible level and not too strenuous, helps to actually mitigate fatigue rather than increase it, which is, of course, everyone's concern. Physical function and fatigue are really important contributions to quality of life. We broadly break quality of life up into 3 areas: the physical, emotional, and the social. There are benefits of exercise in all of these areas. Just talked a bit about the physical function and that management of symptoms. Exercise has a valuable role to play in that. But also, even with social well-being, exercise can be performed on one's own, but it also can be in a social context with other people. And that brings with it quality time with friends and family, the chance to meet new people, make friends, be part of a community. That aspect of exercise, independent of any physiological effects, can be very valuable. So the personal relationships, that social connections, can be one of the byproducts of exercising. And there's plenty of evidence that exercise has an impact on the emotional or the psychological well-being of people with cancer. Feelings of depression, feelings of anxiety, stress, all have been shown to be reduced through exercise. Self-esteem, body image are other aspects of psychological well-being that can be influenced. And I'm just going to show you a couple of quotes from patients which give an indication of that. I'll let you read these yourself. It's easier for you to see them than me from here. I'll just give you a second. And in the years that I've been meeting cancer patients and helping them through exercise, I've heard lots of similar things and some nice examples of how exercise is beneficial beyond the physical effects. Some evidence around prognosis. So this is quite interesting and also relatively new. Over the last 10 years or so, there's been some accumulating data in some of the more common cancers that exercise may have an impact on increased survival times and also slowing down disease progression. So observational data suggesting that those who maintain physical activity after diagnosis actually have longer survival, fewer recurrences, and lower rates of metastasis. It's all fairly preliminary, but very interesting. So far, no evidence in melanoma. But I did find one study, not in humans, but in mice, which I thought was just worth showing you. It's quite interesting, very preliminary, and we obviously don't extrapolate data from a mouse study too hastily to humans. But let me just show you this study. So mice given melanoma cells and then allocated to either receive doxorubicin for a 2-week period or to the drug plus exercise, which involved them walking on a treadmill 5 days over a 2-week period, 5 days a week for 2 weeks. The researchers were interested in tumour size. And what they found was the mice just receiving the drug did have a reduction in their tumour size. The drug was effective, but those patients who also had those mice who'd undertaken the walking intervention actually had a significantly bigger reduction in their tumour size. So interesting, but very preliminary at this stage. Very briefly to mention the risks alongside the benefits with any treatment or intervention or anything we recommend, we want to ensure that the benefits are outweighing the risks. I've just spent a bit of time going through some of the key benefits. And to remind you, maintaining physical function, controlling fatigue, contributing to quality of life and well-being, and of course, physical activity. It's important for reducing risk of other diseases. But there are some risks of physical activity. Some of the more common ones would be the exacerbation of symptoms like pain or fatigue or nausea. Too much exercise can have an immunosuppressive effect. There is a risk of falls with some forms of activity, and bone fractures can be a risk as well. The secret to avoiding those risks isn't really a secret at all. It's really a common sense and choosing appropriate forms of activity and intensities of activity based on individual symptoms, limitations, preferences. Activity goes across the spectrum from running or high-intensity sports through walking to seated exercise. There should be something that's of interest and suitable for patients at any level. And of course, based on individual limitations, you can choose activities. Someone who's experiencing dizziness would be wise to avoid cycling, for example. When immune systems are very low, then swimming or activities involving chlorinated pools are sometimes best to be avoided. If someone's extremely fatigued, they may be very limited, but seated exercise is sometimes an option. And just to finish with a few recommendations, I've borrowed this from an expert report that myself and some colleagues were involved with a few years ago, summarising the evidence that exists and a few general recommendations. And the general recommendation is that unless patients have been advised otherwise by their healthcare professionals, that to aim for the general guideline of 2.5 hours a week of at least moderate intensity physical activity is an appropriate goal. Often it's a case of building up to that slowly. Clearly, activities that you enjoy and are adequate for one's individual limitations are important. There's no recipe for success for everybody. Not overexerting is vital. Some people are very enthusiastic, but you have to listen to the body and do what's a sensible level. But it's important to try not to be too sedentary. We know that there are adverse effects of spending too much time sitting or laying down. Talked about excessive rest already. So at the very least, just try to stand up and move around a little bit more, even if you're not up to exercise, is the general guideline. Right, I think I'm probably out of time. I'll finish there. Thank you for your attention, and happy to speak to anyone later on.